You are viewing Loving Care's in-service on infection control. This in-service is required for all employees upon hire and annually thereafter. You will need the handout titled How to Hand Rub and the handout titled How to Hand Wash, as well as the post-test. The purpose of this in-service is to educate all staff about Loving Care's infection control policies and procedures and how to ensure that all staff know how to identify and report infections occurring in the workplace. Germs are a part of everyday life and are found in our air, soil, water, and in and on our bodies. Some germs are helpful, others are harmful. Many germs live in and on our bodies without causing harm, and some even help us to stay healthy. Only a small portion of germs are known to cause infection. So how do infections occur? An infection occurs when germs enter the body, increase in number, and cause a reaction of the body. 3 things are necessary for an infection to occur. The first thing is a source. Infectious agents, or germs, in the places where they live, such as sinks, surfaces, human skin, are what we refer to as a source. A source is an infection agent or germ and refers to a virus, bacteria, or other microbe. In healthcare settings, germs are found in many places. People are one source of germs, including patients, healthcare workers, visitors, and household members. People can be sick with symptoms of an infection, or they can be colonized with germs and not have symptoms of an infection, but be able to pass the germs to others. Germs are also found in the healthcare environment. Examples of environmental sources of germs include dry surfaces in patient care areas, such as bed rails, medical equipment, countertops, and tables. Wet surfaces, moist surfaces, such as cooling towers, faucets and sinks, equipment such as ventilators or moisturizers on oxygen. Indwelling medical devices such as catheters and IV lines, and dust or decaying debris. For an infection to occur, we also need a susceptible person with a way for germs to enter the body. A susceptible person is someone who is not vaccinated or otherwise immune, or a person with a weakened immune system who has a way for germs to enter the body. For an infection to occur, germs must enter the susceptible person's body, invade tissues, multiply, and cause a reaction. Devices like IV catheters and surgical incisions can provide an entryway, whereas a human immune system helps to fight infection. When patients are sick, the following factors can increase their susceptibility to infection. Patients with underlying medical conditions such as diabetes, cancer, and organ transplantation are at increased risk for infection because often these illnesses decrease the immune system's ability to fight infection. Certain medications used to treat medical conditions, such as antibiotics, steroids, and certain cancer-fighting medications, increase the risk of some types of infections. Life-saving medical treatments and procedures used in healthcare, such as urinary catheters, tubes, and surgery, increase the risk of infection by providing additional ways that germs can enter the body. Recognizing the factors that increase patients' susceptibility to infection allows providers to recognize risks and perform basic infection prevention measures to prevent infection from occurring. The third thing necessary for an infection to occur is transmission. This is the way that the germs are moved from where the germs are to the susceptible person. Germs don't move themselves. Germs depend on people, the environment, and/or medical equipment to move in healthcare settings. There are a few general ways that germs travel in healthcare settings: through contact, such as touching, through sprays and splashes, through inhalation, and through sharps injuries. Contact moves germs by touch. For example, the healthcare provider's hands become contaminated by touching germs that is present on medical equipment or high-touch surfaces and then carry the germs on their hands and spread them to a susceptible person when proper hand hygiene is not performed before touching the person. Sprays and splashes occur when infected body fluids are splashed or sprayed and land on a person's eyes, nose, or mouth. These germs can cause infection. They can also occur from a person coughing or sneezing infected fluids onto another person. Inhalation occurs when germs are aerosolized in tiny particles that survive on air currents over great distances and reach the susceptible person. Airborne transmission can occur when infected patients talk, cough, or sneeze germs into the air, or when germs are aerosolized by medical equipment or by dust from a construction zone. Sharps injuries can lead to infections when bloodborne pathogens enter a person through a skin puncture by a used needle or sharp instrument. There are many infections, different types of infections, but there are certain infections that are particularly relevant for healthcare workers. The first one is HIV. HIV stands for Human Immunodeficiency Virus. It weakens a person's immune system by destroying important cells that fight infection and disease. No effective cure exists for HIV, but with proper medical care, HIV can be controlled. HIV is spread through contact with infected blood or body fluids. It is not spread through saliva, sweat, or tears, so the main risk for healthcare workers would be being stuck with an HIV-infected needle or other sharp object. Another common infection pertinent to healthcare workers is hepatitis. This can be spread to healthcare workers from contact with blood and body fluids. Hepatitis is an inflammation of the liver. The condition can be self-limiting or can progress to scarring, cirrhosis, or liver cancer. There are several types of hepatitis. However, use of standard precautions and avoiding finger sticks will prevent most cases that could occur because of your healthcare career. MDROs, multi-drug-resistant organisms, are bacteria that have become resistant to certain antibiotics, and these antibiotics can no longer be used to control or kill the bacteria. Antibiotics fight infection that are caused by a bacteria. Bacteria that resist treatment with more than one antibiotic are called multi-drug-resistant organisms, or MDROs for short. Some common examples are MRSA and VRE. Multi-drug-resistant organisms often affect people who are older or very ill and can cause bad infections. Most often, MDROs are spread on the hands of healthcare workers. They can also spread on objects such as bed rails, bedside tables, IV poles, and catheters. They can also be spread person to person through direct contact, using sores, for instance. Use of contact precautions can prevent the spread of MDROs. Another common infection is influenza. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza, commonly called the flu, is not the same as the flu viruses that cause diarrhea and vomiting. Initially, the flu may seem like a common cold with a runny nose, sneezing, and sore throat. But colds usually begin slowly, whereas the flu tends to come on suddenly. And although a cold can be a nuisance, you usually feel much worse with the flu. Some common signs and symptoms of the flu include fever over 100.4 degrees Fahrenheit, aching muscles, especially in your back, arms, and legs, chills and sweats, headache, dry persistent cough, fatigue and weakness, nasal congestion, and a sore throat. Flu viruses travel through the air in droplets when someone with the infection coughs, sneezes, or talks. You can inhale the droplets directly, or you can pick the germs up from an object such as a telephone or a computer keyboard, and then transfer them to your eyes, nose, or mouth. So to control the spread of infection, take the following precautions. Wash your hands. Thorough and frequent hand washing is an effective way to prevent many common infections. Or use alcohol-based hand sanitizers if soap and water aren't readily available. Contain your coughs and sneezes. Cover your mouth and nose when you sneeze or cough. To avoid contaminating your hands, cough or sneeze into a tissue or into the inner crook of your elbow. Avoid crowds. The flu spreads easily wherever people congregate, in child care centers, schools, office buildings, auditoriums, and public transportation. By avoiding crowds during peak flu season, you reduce your chance of infection. And if you're sick, stay home for at least 24 hours after your fever subsides so that you lessen the chance of infecting others. And lastly, get a flu shot. The last common infection we're going to discuss today is norovirus. Norovirus infection can cause the sudden onset of severe vomiting and diarrhea. The virus is highly contagious and commonly spread through food or water that is contaminated during preparation or contaminated surfaces. You can also be infected through close contact with an infected person. Diarrhea, abdominal pain, and vomiting typically begin 12 to 48 hours after exposure. Norovirus symptoms last 1 to 3 days, and most people recover completely without treatment. Infected persons may continue to shed the virus in their feces for up to 2 weeks after recovery. Norovirus infection is highly contagious, and anyone can become infected more than once. To help prevent its spread, wash your hands thoroughly, especially after using the toilet or changing a diaper. Avoid contaminated food and water, including food that may have been prepared by someone who was sick. Wash fruits and vegetables before eating. Cook seafood thoroughly. Dispose of vomit and fecal matter carefully to avoid spreading norovirus by air. Soak up material with disposable towels using minimal agitation and place them in disposable bags. Disinfect virus-contaminated areas with a chlorine bleach solution, making sure that you wear gloves. Stay home from work, especially if your job involves handling food. You may be contagious as long as 3 days after your symptoms end. Children should stay home from school or child care. Avoid traveling until signs and symptoms have ended. We have hit on just a few common infections. There are many other infections that you could come into contact with, both professionally as well as personally. So let's talk next about how to prevent the spread of infection. As healthcare providers, it is our responsibility to do everything that we can to prevent the spread of infections. We do this through the use of precautions. There are 2 tiers of precautions to prevent transmission of infections: standard precautions and transmission precautions. Standard precautions, which are used for the care of all patients, regardless of suspected or confirmed infection status, are based on the principle that blood, body fluids, secretions, excretions except for sweat, non-intact skin, and mucous membranes contain transmissible infectious agents. Use of standard precautions is not optional. Standard precautions include hand hygiene, respiratory hygiene, personal protective equipment or PPE, safe injection practices, and sharp precautions. Hand hygiene is the single most important thing that anyone can do to prevent the spread of infection. To wash your hands, wet your hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Next, rub your hands palm to palm with the fingers interlaced. Then, rub the backs of fingers to opposing palms with the fingers interlocked. Then, rotational scrubbing of the left thumb clasped in the right palm and vice versa. The next step is rotational scrubbing backwards and forwards with clasped fingers of your right hand in your left palm and vice versa. Finally, rinse your hands with water. Dry your hands thoroughly with a single-use towel and use the towel to turn off the faucet. To use a hand rub, apply a palmful of the product in a cupped hand, covering all surfaces. Rub your hands palm to palm. Rub your right palm over the left dorsum with interlaced fingers and vice versa. Rub your palm to palm with fingers interlaced. Then, rub the backs of fingers to opposing palms with fingers interlocked. Next, rotational rubbing of the left thumb clasped in the right palm and vice versa. Next, rotational rubbing backwards and forwards with clasped fingers of right hand in the left palm and vice versa. Once dry, your hands are safe. Everyone should be given a bottle of hand sanitizer for your use as you're providing care to patients. You can refill it at one of the refill stations at either office. When performing hand hygiene, antiseptic hand rub is preferred, except for under the following conditions. When hand washing with soap and water is preferred. These conditions would be when your hands are visibly soiled and matter must be washed away. When your hands have been exposed to blood or body fluids, including after using the restroom. When the patient or environment is known to have spore-forming organisms such as C. diff, and before eating or drinking. Hand hygiene is required at the following time points: before entering or re-entering the visit bag, before and after touching patients or objects in the immediate vicinity of the patient, before donning sterile gloves, after removing gloves or other PPE, before preparing medications, before and after performing a procedure such as wound care, IV tubing changes, or after handling a catheter, before moving from a contaminated part of the body to a clean part of the body, such as from wound care to trach care, and after contact with body fluids, excretions, mucous membranes, or non-intact skin. The next aspect of standard precautions is respiratory hygiene. Cough and sneeze into a tissue, not your hands. If you do not have access to a tissue, use the crook of your arm near the elbow. Throw away tissues in a plastic bag lined containers as soon as they are contaminated with respiratory secretion. Perform hand hygiene after coughing, sneezing, or blowing your nose. During periods of respiratory infection outbreaks, consider asking patients who are coughing to wear a mask to contain infectious droplets, and maintaining a distance of 3 feet from others when symptomatic. Now, I should mention that just because a patient is coughing does not necessarily mean they have an infection. Some patients have diseases such as COPD, which are not contagious. For those patients, it would not be appropriate to request for them to wear a mask. But if a patient is coughing because they have a respiratory infection, it would be appropriate. PPE is another aspect of standard precautions. PPE must be worn whenever contact, splashes, or sprays with blood, body fluids, secretions, excretions, mucous membranes, or non-intact skin is likely. The type of PPE needed depends on the type of the patient-provider interaction and the potential for exposure to blood or body fluids or pathogens. Masks, goggles, and face shields protect the mucous membranes of the eyes, nose, and mouth during tasks that are likely to result in splashes of blood, body fluids, secretions, and excretions. Clinicians will be trained on donning and removing PPE on Part 2 of the infection control in services. For now, if you need to care for a patient that requires the use of PPE and you are not sure how to use it, make sure that you speak with myself or your supervisor prior to beginning the visit. It's also important to note that some PPE contains a substance called latex. Frequent contact with latex can cause a latex allergy. Symptoms of a latex allergy can range from a mild rash to difficulty breathing and anaphylaxis. Persons with a latex allergy should not use latex gloves or other latex products and should speak with their supervisor for alternative options that do not contain latex. Another aspect of standard precautions is safe injection practices. Safe injection practices include the following: using aseptic technique for injections, using one syringe with one needle or cannula per patient, considering a syringe or needle or cannula contaminated once it has been used. Do not administer medication to multiple patients from one-dose vials or combined leftover vials for later use. Store multi-dose vials according to the manufacturer's instructions. Discard if sterility is compromised or questionable. The last area of standard precautions are Sharps precautions. When using needles, lancets, or other blood or body fluid contaminated sharps, ensure that you understand how any safety devices attached to the sharp are activated before using the sharp with the patient. Always open the sharps container and have it within arm's reach before using the needle or lancet. Never attempt to break or bend needles or remove contaminated needles from syringes or blood tube holders. Discard contaminated needles and syringes or blood tube holders as one unit. Almost always avoid recapping a contaminated needle. If it must be recapped, use the one-handed scoop method. When sharps containers are 3/4 of the way full, lock them closed, tape them shut securely, and discard them. Use caution when emptying patient trash cans. Ask if there are any sharps or broken objects in the trash prior to emptying the can. In the event that an exposure occurs while on the job, an exposure is defined as any penetration by sharp implement or contact of mucous membrane or broken skin by blood or body fluids. Should an exposure occur, immediately flush the site with soap and water. Immediately notify your unit coordinator. You will be required to complete an incident report. Blood will be obtained from both the employee and the source patient, who will be tested for HIV and hepatitis. Both parties must consent to the testing and sign an informed consent. Employees' testing will be repeated at 3 months, 6 months, and 1 year post-exposure. In addition to standard precautions, transmission precautions may be necessary when additional measures should be taken because of the mode of transmission. Transmission precautions include airborne, droplet, and contact precautions. Airborne precautions are required for pathogens which are expelled from the respiratory tract and ride on air currents. Some diseases that require airborne precautions are diseases such as chickenpox, measles, avian flu, bioterrorism agents such as anthrax or smallpox, SARS, and tuberculosis. Airborne precautions require a fit-tested N95 respirator. Loving Care rarely accepts cases that require respirators, and you would not be expected to see a patient until you have been properly fitted and trained on the use of this respirator. Droplet precautions are required for pathogens which are expelled from the respiratory tract on microscopic droplets. Droplets are projected from the respiratory tract during coughing, sneezing, shouting, singing, or even talking. Droplets and the pathogens which ride on them usually drop out of the air within 3 feet. Droplets are trapped by surgical masks. Many droplet infections are also contact infections requiring both droplet and contact precautions. Some diseases requiring droplet precautions are adenovirus or rhinovirus, or the common cold, influenza, pertussis, and strep throat. PPE required for droplet precautions is a surgical mask, either for the employee and/or the patient, and avoiding being within 3 feet of the patient while not providing direct patient care. Make sure to observe standard precautions, including respiratory hygiene. Contact precautions are required for pathogens that are transmitted by either direct contact with the patient or indirect contact via contaminated items. Pathogens that travel by pathogens that require contact precautions would include most multiple drug-resistant organisms such as MRSA, VRE, and C. diff. Consider dedicating equipment needed for the visit to the patient, such as a stethoscope, blood pressure, cough, etc. Make sure to properly disinfect any equipment used between patients. Other diseases requiring contact precautions would be rotavirus, colds, influenza, impetigo, parasitic infections such as lice or scabies, and shingles. The PPE required for contact precautions would include limiting equipment and supplies brought into the home, placing them in a plastic bag, bringing a clean plastic bag for removing items from the home, considering documenting in the car instead of the home, use of gowns, gloves, and masks as needed depending on the organism. Avoid allowing clothing to come into contact with a location with a high bacterial burden, such as bathrooms or bed linens, and also need to take into consideration the location and severity of the infection. The Infection Control and Safety Committee is the group that is responsible to implement and monitor Loving Care's infection control and prevention program, and has the authority to order that any practice, act, or procedure which is deemed unsafe to any patient, visitor, or employee be ceased immediately. Failure to follow such an order will make the responsible individual or individuals liable to immediate disciplinary action by the executive director or designee, up to and including termination. Part of the job of the committee is to monitor and track for infections which are spread from patients to employees and infections that are spread from employees to patients. If you have any questions or concerns regarding Loving Care's infection control program, or if you would like to be involved on this committee, please see Barb Dixon, who is the committee chairperson. You can also bring concerns about infection control or safety to any of the members of the committee. Employees who complain of feeling ill immediately prior to a shift or while on duty are required to report to their supervisor for clearance to work. Employees with undiagnosed prolonged diarrhea, skin issues such as rashes, boils, or open sores, or a fever with a productive cough. When in doubt, check with your employee prior to starting work if you have symptoms other than those listed. An employee infection report will be completed on all employee infections. The infection report will be kept confidential as a secure part of your personnel record. All incidents are logged, and the information contained therein will be reviewed and summarized by the chair of the Infection Control and Safety Committee for tracking and QAPI purposes. Patient infections should be reported to the patient's nurse case manager and entered in the patient's event log by the RN case manager. Employees are required to report specific infections tracked by the Infection Control and Safety Committee. At the time of this recording, Those infections would include UTIs, wound, and respiratory infections. Any patient who is on transmission precautions, any patient who has a condition that is considered to be a reportable infectious disease by the Ohio Department of Health, and when an employee observes an unusual or unexplained pattern of patient infections or illnesses. In summary, infection control is the responsibility of every employee, whether you work in the office or at the bedside. By observing infection control policies and procedures, we can make a difference in reducing the spread of infection. Questions may be addressed to Barb Dixon, Chief Clinical Coordinator, at 740-852-7755 or at barbd@lovingcare.us. Thank you for your attention to this in-service. For clinical staff, you will also need to view the in-service infection control part 2.